What is a pandemic? A pandemic is the global outbreak of a disease. There are many examples in history, the most recent being the COVID-19 pandemic, declared as such by the World Health Organization on March 12, 2020. Pandemics are generally classified as epidemics first, which is the rapid spread of a disease across a particular region or regions. The Zika virus outbreak that began in Brazil in 2014 and made its way across the Caribbean and Latin America was an epidemic, as was the Ebola outbreak in West Africa in 2014 to 2016. The US has been experiencing an opioid epidemic since 2017, because of the widespread misuse and high numbers of deaths caused by the drug, according to the US Department of Health and Human Services. COVID-19 began as an epidemic in China, before making its way around the world in a matter of months and becoming a pandemic. But epidemics don't always become pandemics, and it's not always a fast or clear transition. For example, HIV was considered an epidemic in West Africa for decades before becoming a pandemic in the late 20th century. Now, thanks to advances in modern medicine, HIV is considered endemic, which means the rate of the disease is stable and predictable among certain populations, according to the American Medical Association. Most virus pandemics have been caused by influenza, flu, viruses. Flu viruses can change from season to season, and while health professionals are pretty good at predicting how the virus will change, occasionally a new virus pops up that doesn't behave as predicted. That's when a pandemic is most likely to occur, because most people don't have immunity to the new virus. The most deadly pandemic in history was the Spanish flu of 1918. The virus infected an estimated one-third of the world's population and was responsible for causing between 20 million and 50 million deaths. That's an estimated 1% to 3% mortality rate. The virus didn't originate in Spain, but the country was the first to report on the outbreak, so people began calling it the Spanish flu. The 1957-1958 Asian flu pandemic was triggered by a new strain of influenza A virus, H2N2, that emerged in East Asia, according to the Centers for Disease Control and Prevention. The virus killed an estimated 1.1 million people worldwide, which corresponded to an estimated death rate of 0.019%, according to a study published in the Journal of Infectious Diseases. The 1968 Hong Kong flu pandemic was caused by a new strain of the H3N2 virus that arose in Southeast Asia. Again, the pandemic earned its name because of where initial news reports of the outbreak originated, and not because of where the virus originated. The Hong Kong flu killed an estimated 1 million people worldwide, or about 0.03% of the world's population, according to the CDC. Please leave us subscribe and like if you'll learn something new, and for more interesting videos. To get the Pandemic Survival Guide, check the descriptions below.